Hi, I'm Taylor. I'm a master esthetician at Rêvée Aesthetics.
Hi, I'm Ava. I'm the RVA Skin Fairy at Rêvée, and I'm going to be talking about BBL or broadband light today. And so BBL, not to be confused with Brazilian butt lift, this is the laser by Cyton.
BBL is a type of laser that is going to target reds and browns in the skin. IPL is generally pretty safe for most of its fat tricks, usually on the lighter skin tone range.
And so broadband light, we categorize it in our family of lasers, but technically it's a light-based therapy, so we're actually not breaking open the skin. We're actually just focusing on reds and browns in the skin. So we're able to focus on either like the melanin or the pigment, and then also the reds, and target like broken blood vessels or unwanted sunspots.
So you can get BBL on any part of the body, anywhere that you have sunspots, freckling, or rosacea, anything like that. Typically, when people get their face done, they like to get their neck and sometimes their chest if they have a lot of sun damage.
We also do a lot of backs and arms and hands. We tend to forget about our hands and arms, but especially if you're someone that drives a lot, our left side tends to get a lot of sun exposure and get sunspots as we age.
So we like to do at least 3 in our first session, about 4 to 6 weeks apart. And then after that, a lot of people come in like maybe once or twice a year to get touch-ups to make sure that sun damage is lasting, get them right when it's like new.
So before you come in for a BBL, you really want to make sure that you're not getting any sun exposure.
Because that is very important. This is just not a sun-safe procedure. Things can go wrong if you are like directly in the sun.
Which obviously that doesn't mean that we want you to hide inside like a hermit. You can still be a normal person and go about your life, but you don't want to have any extended sun exposure. So that means about like 30 minutes of being outside. And that's even with SPF. So no like going to a baseball game or being at the beach. You really want to make sure that you're as fair as you can be so that we're not targeting, your normal skin. We're really just focusing on those sunspots. That being said, you also don't want to use self-tanner because that can trick the laser into targeting that instead of those unwanted sunspots as well.
When you come in to get a treatment, we do a consultation, we look at your skin.
We take some pictures, I'm going to numb you.
Typically for BBL, because it's not as hot as like say Moxie or Halo, we don't have to numb you for as long. So typically I'll do like 15 minutes and people will be comfortable.
It's gonna feel like an ice cube on the skin, and then you'll see a bright flash of light and feel a warm rubber band snap. I always do a test spot before we do the whole face. I've never had anyone not be able to finish the treatment. And then the actual treatment of the handpiece on the skin is gonna take me about 25 to 30 minutes. So overall, you're in here for about an hour.
After the BBL, you'll have a kind of like a light rosy sunburn. It won't really be anything too bad. There's not really any downtime. The sunburn feel will last maybe a few days at most.
Your aftercare is really easy. It's just gonna be really gentle skincare for the next couple of days. Sometimes if we're focusing on like sun freckles on the skin or unwanted brown spots, you will have a little bit of flaking if those brown spots start to flake off over the next couple of days. So you don't want to use anything exfoliating or irritating for about a week, just to make sure that you're not irritating your skin after the procedure.
My favorite part about BBL is that it almost adds like a clarity to the skin. When you have like really slight freckling, you don't really notice how much of it you have until it's gone, and how clear and just like clean your skin looks almost. It's a really, really nice procedure with people with freckling, and you don't know that you need it until it happens.
My favorite part of BBL is that as soon as you leave and over the course of a week, the patient can actually see that something is happening. You can physically see those brown spots get darker and flake off, which is really fun, and you can tell that something is happening on your skin.